Hi, welcome everybody to the podcast series on innovation in healthcare, sponsored by the Conference of Consulting Actuaries, or the CCA. For those of you who've seen this before, you kind of know these are a series of interviews we're doing with actuaries and other professionals focused on delivering innovation in healthcare. If you haven't had a chance to view some of the past sessions we've done, please go out to the CCA website at ccactuaries.org. And you'll be able to find those out there. I'm sure you'll enjoy those sessions, and I'm sure you're going to enjoy this session and all the great discussions we have, highlighting the interesting people, products, and services really designed to drive a better healthcare system. These sessions are offered to provide insights about what's transpiring in the ever-changing healthcare environment in which we live. Now, for those of you who are actuaries out there, these sessions are not necessarily designed to offer continuing education credit, but each viewer can assess for themselves if it meets the criteria for such credit. My name's Ed Podlosky. I'm president of Morningstar Actuarial Consulting, and I'm also the chair of the healthcare community within the CCA, and I'm going to be your host today. I'm very delighted to be joined by Jason Boricki. Jason is vice president of Actuarial Services at Monogram Health. He's a fellow to the Society of Actuaries, a member of the American Academy of Actuaries. And prior to joining Monogram Health, Jason worked at Landmark Health, Gateway Health, Molina Healthcare, Optum Health, AmeriGroup, and enjoyed a consulting career with both Willis Towers Watson and Mercer. So I think it's pretty safe to say that Jason just has a wealth of experience to share with us today. Jason, thanks for joining us.
Thank you, Ed, for that great welcome.
Anything more about your background that I didn't touch on that you'd want to touch on for our audience?
I would just say that a background across, Medicaid, Medicare, commercial. So again, yeah, you covered most of it.
Good. Again, just kind of a wealth of experience. So I really appreciate, again, you being here. So Jason, for our viewers who perhaps are not familiar with Monogram Health, please give us an overview of what the company does.
Sure. So Monogram Health is actually a provider group. We provide in-home care to members that have chronic kidney disease or ESRD, end-stage renal disease. And what we do is we provide nephrologists, nurse practitioners, dietitians going to the home, managing the care, and getting them on programs to help, if they have CKD, stop the progression of the disease, and if they're on ESRD, to manage it. And also, Monogram Health is a big proponent of at-home dialysis, where people, if you have a job, it can be very difficult to go to work, or go to dialysis 3 times a week for 4 hours. And so I think the average rate of the United States is about 10%, and Monogram is about 30% in-home dialysis. And if you look at other countries, they usually have higher at-home dialysis rates as well. Mostly just, it's easier to have a more normal life, carry on a job, and a lot of people do enjoy, staying at their home. On the flip side, there are some, members that are older, maybe don't have as much family, so there's a benefit for them going to the dialysis center to get the interaction with others. So we, focus on what's best for our members, and where we really provide value. We contract with payers, and we also provider groups. And where we provide the most value is probably reducing inpatient admissions, readmissions, ER visits. And we do that by going to the homes, providing care, doing biometric screenings, keeping track of the members, instituting diet plans, and exercise regimens where applicable.
So Jason, you kind of cited an interesting statistic that you and I talked kind of as we previewed this session, which I found very intriguing, and I didn't know about the 30% dialysis rate that you all have. And I noticed there were a number of other statistics that I saw on your website to me that were pretty intriguing. 28% home dialysis rate when the national average is around 10, 45% planned dialysis starts, again, when the national average is about 20%. And even more impressively to me was, the 18% reduction in readmission rates, 70% new engagement, and then 775 PMPM ROI, which I assume refers to engaged kidney patients as opposed to across all members. But those are pretty impressive statistics in my mind. So what does Monogram Health do differently than the typical health plan to achieve these type of results?
Well, I think the big differentiator for Monogram is having the in-home care, and they're also manage the care. There's some other companies where they work with the PCP, but in this case, Monogram's the acting provider, and we have nephrologists who coordinate all the care. So I think that's one of the big places where we distinguish ourselves.
Okay. And you mentioned to me 90% of the people with chronic kidney disease don't know it yet, right? That was kind of an astounding statistic as well. So what does Monogram do to identify those people and get them the treatment they need before the disease progresses?
Sure. So there are other chronic conditions that are highly linked to CKD. So we are able to go through claims data, identify those, and of course, you can identify the CKD ICD-10 code. So what is a little different about Monogram is we look at conditions that are highly correlated to CKD, and then we're able to come up with a list of members. We have a strong idea have CKD, and then treat them and stop the progression. Because once you do have CKD, you have it for life, but there's been a big push by CMS to identify them sooner, because normally what happens is they don't know they have CKD, they have it for years, and then they crash into dialysis, which is a very costly inpatient event. And then, you know, the health plans are on the hook for it. The member then usually transitions to dialysis, but with identifying it sooner, we can slow it and hopefully keep them from crashing.
Great. So let me ask you, do you work typically with kind of the large health plans and come in and take over kind of those functions within large health plans, or do you also work with kind of large self-funded employers? Who are your clients?
At this time, it's mostly large health plans, but we would contract with large employers as well. Additionally, we work with provider groups. So wherever we see an opportunity to engage members and affect their care, we're willing to contract with them.
Great. And do you work at all in the Medicare and Medicaid space?
So good question. We mostly work in Medicare. However, we do work on Medicaid and commercial as well. So because about 1 in 7 adults have CKD, which is roughly 37 million people in the US. So a very large population. And additionally, I think this spends about $120 billion a year. So Monogram's one company, but there's several others. There's been a big push by CMS. They started a 2019 ESRD pilot, which showed savings. So they're very happy with that. And then in 2021, they kicked off a CKD program as well. Now those focus on Medicare fee-for-service, but we work on that as well.
Okay, great. So you're an actuary. That was evident in your bio. So what do you do for Monogram Health? What's your role as the VP of Actuarial Services?
Well, the first thing we do is we help with the contracting, making sure the risk we're taking on is suitable. And so we negotiate that with the health plan or the provider group. Once we do that, we establish a baseline. So we look at the period of time before Monogram intervenes in the care, and we'll establish a target. So a lot of our contracts are MLR based or medical loss ratio. So we'll say, let's say, for example, we develop the baseline is 110%. We'll contract with the health plan. We'll guarantee them, let's say, 5% reduction. So for the performance period, we would have to meet 105 MLR before we start to share their savings. That's one variety of value-based contracts we do. There are others, but I won't bore you with those.
All right, but it's safe to say that your primary responsibility then is kind of establishing and managing the risk associated with those value-based contracts.
That is correct.
Yeah. So how do you strike the right balance between your value-based contracts, between the need to create a better quality outcome and generate more cost efficiencies and developing kind of that strong network of providers?
Well, we are the providers, so for the most part, and then we also work with the providers from the health plan. So really, to be effective and reach as many people as we want, we need to create density in an area. Just so, unfortunately, in our type of practice, there's a lot of provider burnout. If they have to travel like 20 miles between members, it's really difficult and stressful. So it's all about, finding an area, and then, we start a program there, and then we try to expand within that area, just so our providers and physicians, nurse practitioners have the ability to see as many patients as possible without traveling a lot.
I see. So what groups do you, work with within Monogram Health, to do the work that you do?
I'll definitely work with legal, establishing the contracts. Then we work very closely with healthcare economics. We will, as we monitor and build models, we'll look at the trends and we'll see things. We'll pass it along to healthcare economics outreach program. If we're seeing members that, aren't reaching their targets, or if we notice specifically there's certain geographic areas that aren't performing well, we might do a more robust deep dive, saying why is it, is it the density of the population, they're not getting the visits they need, or are there other factors?
I see. So what's kind of most rewarding aspect of what you do?
I think being able to provide care in the home. I know a lot of people don't like going to the doctor's office, myself included. So I think, and also making their lives more normal as possible. I think, a lot of people, especially when they have ESRD, having to go to a dialysis center 3 times a week can be intimidating. Also, a huge portion of your week. So I just think being able to provide care at home is most beneficial.
So anything else about Monogram Health or your role that I didn't ask that, our audience would love to hear?
Well, I would just say for the actuaries out there that we do all the actuarial functions. So on a monthly basis, first we'll establish the baseline, but then we'll forecast out what we think the performance period is. And then on a monthly basis, as the actual claims come in, we'll do IBNR estimates, update the forecast, project forward, report the financial results. We do risk score modeling because most of our clients are Medicare Advantage. So when we're predicting the revenue for the year, we need to know what the risk scores are going to be. So we have to calculate both the mid-year and final year sweep. So there's that aspect as well. And then we do a lot of studies where we're trying to show our value during durational impact of our care. So a lot of actuarial flavor there. So not just the contracting.
Excellent. So Jason, I also like to kind of end our interviews with kind of a more personal question. So, if you weren't an actuary, what would you be doing now? What would be your other life passion?
That's a good question. Well, I was a teacher before being an actuary. So I think I would do that. I think I learned some valuable lessons. One, people really don't like math. So I would try to cater more to people that do like math and, just try to further that. And also I would be a huge advocate of the actuarial profession. I didn't know about it until grad school, which I wish I knew a lot earlier. I could have maybe knocked some exams out and not have to take some exams when I was working. So definitely would have enjoyed that. So just getting the word out about the actuarial profession. I know now there's a lot of competition with data science. So I think, I would encourage people to do either, but I think I would also like to tell them more about actuarial science so they make a decision based on facts. So.
Well, you're a great advertisement for all those young student actuaries out there, or students who are taking the actuarial exam. So I appreciate those comments. I'd like to encourage our viewers who also participate in our healthcare community to continue, any discussions about the insights shared here on that platform. So if you're not a member of CCA and you want to consider joining to, not only experience the benefit of the community platforms of the CCA for informal discussions, but also all the other great benefits that our members enjoy. Jason, thanks for being here today and sharing your experiences about Monogram Health and what they're doing to drive innovation in healthcare. I'm sure our audience benefited from the time you spent with us. I know I did.
Thank you, Ed. I enjoyed it.
All right, take care. Bye.